stressed. Being diagnosed with insomnia, it happens all the time. It is a verifiable insurance code. Insomnia is not necessarily recognized as a disease, but it does lead to many numerous health problems. Lack of sleep can, as many of us know, causes reduced energy levels, lack of motivation, slower reflexes, irritability, disorientation, and dark circles under the eyes and fatigue. There are many different ways of classifying insomnia, so I included two for you here today. The first one, classification scheme, is basically they take insomnia, there are three different types. Transient insomnia is defined as insomnia lasting less than 2 weeks. Short term is defined as between 2 to 4 weeks. And chronic is lasting for more than 4 weeks. The transient insomnia complaints are more than likely situational or related to some kind of medical stress. Chronic insomnia, though, can be likely or caused by psychiatric or actual circadian rhythm disturbance. The American Academy of Sleep Medicine has 11 different types of insomnia that they define, and I'd like to just go through them with you here today. Sleep onset insomnia is like it sounds, just difficulty falling asleep. Sleep maintaining insomnia is where you're actually waking up after falling asleep. Maybe you fall asleep okay, but you're just not able to stay asleep. You might wake up suddenly and be unable to fall asleep. It also describes that in-between state where one feels half awake while sleeping, and also includes waking up too early and being unable to get back to sleep. Adjustment insomnia, this is also called acute insomnia or short-term insomnia. This is usually coming from some kind of stress. The sleep problem will go away, though, when the source of stress is addressed, or your body actually adapts to the stress. The stress can come from a negative experience or possibly a positive experience. Maybe you're really excited about something. There's also a condition known as behavioral insomnia of childhood. This occurs when parents do not give their children set regular bedtimes. If children are made to go to bed at a specified time, they do tend to fall asleep at a normal hour. Idiopathic insomnia, this is a lifelong sleep disorder that starts during infancy or childhood and continues into adulthood. It would not be caused by any type of sleep disorder, medical problem, psychiatric problem, a stressful event, medicine. It results from some kind of imbalance in your body, such as an overactive awakening system or a hypoactive sleep. But the cause of the disorder still remains unclear. Insomnia due to a drug or a substance, usually the main culprits are medication, caffeine, alcohol, or some type of food that's bothering you. I have many patients that find that if they are sensitive to gluten will actually affect their ability to fall asleep or stay asleep. Insomnia due to a medical condition, this would be some kind of psychological problem, but usually the insomnia is so severe that it's addressed separately. Insomnia, non-organic, unspecified. This is caused by some type of underlying mental health disorder, psychological factors, sleep disruptive behavior. It's used from a clinical standpoint during the evaluation and testing period of somebody being treated for insomnia. Insomnia, organic. This is again caused by a medical disorder, physical condition, or substance exposure. The specific cause remains unclear, and again can be used while the clinician is trying to determine the cause of the person's insomnia. Paradoxical insomnia, this is the type of patient that it doesn't really match up. They're saying that they're not really sleeping very well, but their symptoms aren't really correlating with that. They usually describe having an intense awareness of the external environment. It also suggests some type of hyperarousal. And a key feature for this diagnosis is an overestimation of the time it takes them to fall asleep. And they also underestimate their total sleep time. Psychophysiological insomnia, this is caused with excessive worrying. The insomnia sufferer of this type worries about not being able to fall asleep and actually precipitates the condition. They may become tense and anxious as